thanks so much for joining today to talk with me for the Communities for Health blog.
Yes.
Lamond, you have obviously been involved with the challenge for quite some time since you started out at the Aetna Foundation with launching the first cohort and now serve on the advisory council. But I'd love to give you a moment to introduce yourself and your history with the challenge, as well as your current role with the city of Norwalk.
Sure. Thank you, Brittany, and thank you for inviting me again, and look forward to a great conversation. So I'm really excited to have been a part of the inaugural development and design of the Healthiest Cities and Counties Challenge. I was served as one of their consultants, and my role was working with the 50 cities and counties. From the beginning, I was a part of the development of the original RFP to the implementation, working with our colleagues at APHA, to the actual selection of the 50 cities and counties, and then working with them over, I think, the year and a half, and visiting many of them and learning of the great work they're doing. It's just been an amazing experience. So, and then because of those experiences, I've been able to land a job in local city government here in the state of Connecticut. I am the Chief of Community Services for the city of Norwalk, Connecticut, not California, because sometimes I get a lot of emails and people think it's California. And I learned that there's a Norwalk, California. So shout out to Norwalk, California. And so in that role, I oversee what I call the touch points, the touch points of the city, and that's the health department. And as you can imagine, we've been very, very busy, like many of the health departments across the country, supporting and helping to mitigate and inform and educate our community around the COVID-19.
I'm really glad that you offered to talk with us today about the American Rescue Plan and your experience navigating that new funding stream that has been sort of a silver lining that's emerged out of this pandemic situation, and how you think the Healthiest Cities and Counties Challenge communities might want to leverage those dollars. So I was thinking, to get us started, it would be great to hear a little bit about how you have leveraged some of that funding in the city, and your experience navigating that process, and what you think maybe makes it a unique funding opportunity compared to the usual funding streams that would support the kind of work that you're doing.
Yeah, so actually, I pretty much read the legislation, so I really wanted to understand it. And one of the things that is written in the legislation is around an opportunity to look at issues and move the needle on things that we haven't done, whether we didn't have the resources or just the funding streams weren't connecting. And so I say ARPA. So, I'm often saying ARPA dollars. So, through the American Rescue Plan dollars that all cities and municipalities and counties and states and our tribal communities receive funding. So I want to make that very clear. Whoever's watching, your city, county has money, okay? And so this is that opportunity. I believe it was designed to be that opportunity to help and support communities. I think we all will agree that the COVID-19 pandemic has hit our communities, and some, much more severe than others. But here's the point I want to elevate, that when I talk about COVID-19, what have we learned? Well, I'll first say people were struggling before COVID-19, before the pandemic. People struggling, whether from a health perspective, a social and economic perspective. But what I believe that the pandemic has really shed a light on those without voices, our most vulnerable, our marginalized communities, our Black and Brown communities, and our other communities that are struggling. And so I really see the dollars that all municipalities have been given to begin to tackle these hard issues, but also bring partners to the table, because one entity cannot do it alone. And so here in the city of Norwalk, under the leadership of Mayor Harry Rillen, who I report to, when we talk about the ARPA dollars, we're looking at where can we use these dollars to make a big impact. recognizing that the city, the municipality cannot do it alone. So we have invited our nonprofit organizations and our community partners to the table to say, help us figure it out. We have some prioritizations that from a city perspective, but we want to make sure what are the priorities of the community, and then how do we then align those priorities and then agree upon this is the best way, this is the way to make a difference, especially those communities that have been hit hard by the pandemic. And so we've had conversations. I facilitate the city's community providers network, over 60, 70, sometimes 80 individuals and different sectors in the nonprofit community are on that call and have opportunity to talk about, what do you see? What are you struggling with? How has COVID, the pandemic, impacted your organization? And from those conversations, we are developing our priorities to, as I understand it and heard different federal elected officials that said, the goal is to get this money out now. The community needs it. So we're working through our own processes to move very quickly because the community needs some help and some support.
I think that you touched on a really important point there, Lamond, about how these disparities existed long before the pandemic, and that while they've been exacerbated and there has been more attention drawn to these issues, they certainly aren't new. And so even though there have not always necessarily been the resources dedicated to addressing those issues that have been really needed in the past, I'm glad that these funds are available now to start to address some of these problems that communities are facing at the local level. So I'm wondering, food access and access to care are two of those issues that have been longstanding disparities in many cities and counties. And those are the two areas that the Healthiest Cities and Counties Challenge grantees are working to address right now. How do you think the ARPA funds specifically could support the work of the challenge communities to address food access and access to care at the local level? And what might our city and county partners consider using these funds for to address those elements of their work?
Sure. Well, first, let me say I'm not an expert in all of this, but what's important to me is I want to encourage the nonprofit in the Healthiest Cities and Counties grantees who are watching. Number one, if you have not read the U.S. Department of Treasury guidelines, pick it up. And you don't have to read the 200 pages that I did, but there are fact sheets, because which is exciting is the ARPA guidelines articulates what are those eligible uses. And Brittany, food insecurity is one of them. And that's what is exciting. The health our community is one of them. So they are already eligible. The federal government has deemed that these are important issues and is encouraging communities and states and counties and local governments to allocate funding for those specific areas. And so when you look at the documents, there are many things you can do. You can expand your food insecurity programs. You can leverage that. How do I take public and private entities and build support? Because we also want to talk about sustainability. This is a shot of resources, but it's only for 2 years. And so what happens next? So when I think about food insecurity and healthcare, looking at bringing the right people to the table, having those conversations, and then engaging your local community. And I know I'm kind of jumping around a little bit, but I want to encourage those that are watching, you got to get to those tables, and every community is doing it differently. Here in the city of Norwalk, I did look online to identify how folks were doing it. Some cities are doing surveys in their local communities. Some cities are inviting people to the table. But what's most important is that the issues that are important to us, the issues that grantees are looking to intervene and provide some sustainable interventions, are eligible. What I also want to emphasize, Brittany, is that if you're doing any work around evidence-based practices, guess what? The federal government through ARPA dollars supports evidence-based. I feel like I'm doing like a sales pitch, but I'm excited about this because the first time it also feels like an acknowledgement of the work that we do all the time. And it calls out food insecurity. It calls out the disparities around healthcare costs, around healthcare as a whole, our social well-being and our health well-being. It calls out mental health. Our communities have been impacted from children up into our elderly, the impact of mental health. So I don't know if I answered your question, but I think what's important is you got to educate yourself to understand what's eligible. And based on your work as a Healthiest Cities, if you're doing it, you need to let your community know and say, we're doing it. Because the other piece is, from a nonprofit perspective, we know it works. We don't have to reinvent the wheel. We know, we have the models, we know the systems, we have the partners. And so I feel it's contingent upon local municipalities to rely on the community-based organizations and the partners in the community that is doing the work. We work with the people, we're on the ground, that boots on the ground model. We know what's happening and we can make bigger impact with these additional resources that has been allocated through the ARPA dollars.
Absolutely. I think, Lamond, you did answer the question, because really what you're getting at is there's some flexibility here in how these funds can be used, but there's also a clear indication that food insecurity is one of the issues, that these funds can be leveraged for. Absolutely. And so it's really up to each community to determine how to apply those funds to address that specific issue. And so each grantee's positioning within that might look a little bit different because they're all doing unique work. And
this is, if I can interject to your point, because while the eligibility is very flexible and it is very broad, and now I'm putting on my municipality hat, and I'm sure other communities have experiences too. You have to prioritize. And so I think what I'm saying to the grantees is that if your municipality has not if what you're doing is eligible, that's step one. Number two, if your community or those that are, whoever is responsible for administering the funds in your jurisdiction have not prioritized, there's a role that you would have to play, and that's education. Because what I've also learned is sometimes we make assumptions that, oh, they know. Well, they may not know. And so I think it's important for us as practitioners, I'll say it that way, to then, hey, can we talk to you about, I see my city is not prioritizing food insecurity. Are you aware? And that's where that data comes in. That's when those stories come in. And that's where that conversation comes in to bring awareness on the issues that you see, that you work with, and hopefully whoever is responsible for administering those funds, they can allocate different dollars, or they can reconsider what those priorities are. So although the guidelines are broad, they're flexible, and there's a lot of good stuff in there, and some cities received hundreds of millions, some cities receive a little bit. So it all depends too. But what's important is it's eligible. And if your city has not prioritized, find opportunities to bring education and awareness to the decision makers.
I appreciate that you just offered us a couple of clear action steps. One, read the documentation, find out if your work falls within the eligibility criteria. Step two, talk to the person who's in charge of those funds and make sure they know what your work is and why these funds need to go in this direction. If I'm in a community and I don't know who might be responsible for managing those funds, where would you suggest that I start in trying to develop a relationship or doing that outreach to establish a partnership to be able to leverage those ARPA funds?
That's a great question. Well, one of the good things is that wherever you're located, the number one, it's public knowledge. And so if you just Google ARPA in your community, I would imagine something will come up. And I'm sure this is, it may look a little bit different from state to state, but here in Connecticut, we actually have a website, and it tells you what funding amount each city has received. So you can go online, and I would imagine it's something similar. And then just follow the Google stream. Most of the time, again, each jurisdiction a little bit differently. It can be your local chief elected official's office that may be administering the funds. It can be your local your legislative council. Here we have common council. Some people call it board of aldermen or county. So find out where those decision-making bodies are. And again, it's a little bit different from community to community. It could be your Health and Human Services commissioner or director. But I think what's important is, I think if you just reach out to your local government or county government, or even your state government, all state governments have a Department of Social Services or Department of Health, and you can say, hey, who's responsible for administering this in my community? I'm sure they can assist you. And then also, I think looking at, I know that in the Midwest, some of the United Ways are taking a strong leadership role, but again, it looks different from region to region. Your National League of Cities, Conference of Mayors. So there are a lot of ways, but I do believe that if you just go online and put ARPA in your city, something will pop up. I know the press has been reporting a lot on how cities are administering the dollars.
Great. So eligibility, Google, and starting to do some education.
Yeah.
How do you think, you had talked about stories before, stories and data being the things that you want to, present to the local government officials who are managing these funds. How do you think community voices can be brought into these conversations? What would you consider to be the most effective way to communicate those individual stories to elected officials in an effort to bring them on board for utilizing the funds for food insecurity?
Sure. As a nonprofit, you all can be very creative in how you elevate the great work you do every day. I used to do coffee with the legislator or breakfast with the legislator. And I would also probably say you got oftentimes what I found to be effective is early in the mornings. It just, for some reason, we were always just to get a better crowd. And I think identifying individuals, constituents that have utilized your service and see if they're willing to share, because making it personal, because of this service, my life has been, and they can fill in the blanks. So I really believe that bringing in community voice, and not just necessarily as a recipient of the service, but also just to say, hey, that service is good for my community. Because oftentimes, and I'm talking little secrets, policy leaders, we do this work, we get paid to do this work. So they expect us to be advocating. And I'm not saying that's wrong, but also having someone that I have nothing in this, but to say, this is important to my community, or this is important to me, or this service has really changed my life situation. So I would suggest all of it. But to your point, bringing in constituents to share, to talk about their experiences and why these services, or why we need more of, I would say that's the top.
Thank you, Lamond. So what I'm hearing is, these ARPA funds, they were released some time ago, but it sounds like it's still not too late to leverage that funding stream and to have an influence on where those funds are going. So what would you say the sense of urgency is around, getting in touch with local officials, and how long do our communities have to potentially be able to get some of that funding allocated towards their work?
Sure. So the sense of urgency is now. And, as we talked about, shared, finding out who's responsible or how your city will be administering those dollars. You can find that out online. Here's the exciting thing, that the way the dollars are being administered from the federal government, it's going to be done over 2 years. So, and again, I'm not the expert, but your city, county, or state already see its first half of those dollars. They have it right now. All right. If they tell you they don't, give me a call. But then secondly, the remaining dollars are coming in year 2. So even if you were not involved in the process that it's happening now or have happened, and helping or being a part of or educating or advocating, what the priority should be, you do have a year 2, but you want to start that education, make your organization aware of. And I think what's important too, because I'm talking maybe individual, I think I also I want to elevate to, coalition. So, because even as I think about the work we're doing, we're not, at least in Norwalk, we will be funding some individual organizations, but we're also thinking about funding partnerships and coalitions. And we know that's the trend nationwide around who you're partner with. So when you think about, we talked about food insecurity, who else is doing food insecurity in your community? And how can you come with one concerted voice around why this matters in our community? Same thing with healthcare and health interventions. How can you come with one voice around why this issue or why this matters to your community? I want to encourage that you think about it from that perspective. But there's time, there's funding, there's a year 2, and build that coalition, build that partnership, strategize what you think the needs are and how you think ARPA dollars can support, amplify, elevate. And again, it has to be COVID related, but once you read the document, it'll lay it all out. I think you have an amazing opportunity to advocate to help your community thrive.
Well, thank you, Lamond. It's exciting to hear you're talking about partnerships, because as you know, that's what the Healthiest Cities and Counties Challenge is all about. So I think our 20 communities are really well positioned to leverage this funding stream. And I really appreciate you taking the time to share your insights on this topic with me today.